One thing that you mentioned in your book that I wanted to ask you to address, it's something that people have a misunderstanding about, and it's Candida infection or yeast infection. Yeast infection, most people think of a woman's yeast infection. However, yeast can really affect the entire body from head to toe. Can you kind of talk about that a little bit?
Yeah, good question. Yeast, when we look at it from a standpoint of systemic yeast, meaning getting into our bloodstream and manifesting with symptoms like gas, bloating, chronic fatigue, sometimes there'll be a skin rash. There can be also problems with digestion and heartburn, for example. This occurs because, again, of the onslaught of carbohydrates and sugars in our diet, sometimes from antibiotic use and from steroids and asthmatics, for example, but mostly from our diet, unfortunately, that's laden with sugars and starches. And the reason for that is that viruses, including funguses like yeast, feed off of sugar. So when our sugar levels rise in our blood because of our diet being laden with carbs and sugars, it becomes a major fuel source and food source for Candida. So we have Candida overgrowth. So the nice thing about Fight Fat with Fat is that we eliminate these sugars, we eliminate the risk, and the bad carbs, of course, we eliminate the risk for fungal overgrowth systemically, yeast, Candida, and hence we can generally combat that within a couple weeks of being on the diet.
In Fight Fat with Fat, you actually have a dietary protocol that you recommend to help people get away from a lot of the carbs and take in the good sources of fats and proteins. Can you tell us a little bit about that?
Yes, absolutely, Sherry. What we've decided over the last, for example, 10 or 15 years, we've noticed when we do glucose tolerance tests with insulin on our patients, and we try to do them on most patients, we're finding that insulin is stuck, so to speak. We can't budge insulin. The levels on our average patients have been rising through the years. And when we're giving them 20, 30, 40 grams of carbohydrates, we can't get insulin down, hence they still can't lose weight. It's because of the onslaught of the diets with high sugars and carbohydrates. So we came up with a program where what we call it the Fat Fast, which is the first part of our book, where we eliminate all carbohydrates for a couple weeks in order to, quote, unstick insulin. We want to get insulin levels to start to drop. And the only way we found to do that is to take away any stimulus to insulin. So the first 2 weeks to a month for our patients is involved with just having protein and very high fat.
Okay, so not even any vegetables?
No vegetables for the first 2 weeks to a month.
Interesting.
And again, it really depends on their glucose tolerance test, but most of our patients now are put on this program because, as I said, the onslaught of the high levels of insulin.
Right.
So it lasts 2 weeks to a month. There's a little bit of a withdrawal phase the first couple of days.
I bet there is.
It's a little tricky. And then we slowly but surely add back the good carbohydrates, like vegetables first, then fruits, and then eventually we can add back certain even whole wheat grains, depending upon the activity of the patients, for example, and how much weight they've actually lost and how close they are to their ideal body weight.
Right.
But we pay attention, and that's called our marathon phase of the diet. So we start adding back carbohydrates, but the good ones.
Right.
But in the initial phases, we have taken away almost all carbohydrates for 2 weeks to a month, and sometimes it'll last even longer on patients. Patients feel good, they continue to want to stay off the carbohydrates, and they may do it for 3 or 4 months, and as long as they're monitored by their physicians, it's generally quite safe and there's no issues.
Okay. And then after that, once they're through that marathon phase, you said they introduce the carbs slowly. What is the recommended balance after that? Is there any certain balance that they should achieve?
Good question. It generally is very much individualized, and again, it depends on individual metabolisms, how much activity a patient is partaking. So if they become a marathon runner, as yourself, they may want to start, and they can increase carbs. And we've had some patients up to 120, 130 grams of good carbs a day because they're burning that off and it's not an issue. But generally, we find most patients don't do well above 60 to 70 grams of carbs per day.
Okay.
Which is important. The other issue, by the way, getting back to the fat fast, the initial phase of the diet, we're finding, for example, when we produce ketones, when we do that, when we are in the initial phase of my diet, the ketones are preferential to damaged nerve cells in the brain, for example. So we're seeing changes in memory for the positive.
Oh, nice.
They're also doing research on this at the NIH National Institutes of Health for Alzheimer's treatment, for example, because ketones are a preferred energy source for our brain cells that are damaged with Alzheimer's, for example.
Right.
Also for children that have epilepsy, doing a ketogenic, this type of fat fast and just fat protein diet will actually stop seizures, in particularly in children.
Nice.
In its path. So and that's been well researched. So there's a lot of huge benefits to taking away carbohydrates, at least initially, from a diet.
Very nice. And now the other half of that, you mentioned a few moments ago that it's diet and lifestyle, meaning exercise.
Absolutely.
It's a dirty word to a lot of people, but it's also very necessary. What advice do you give your patients in terms of exercise? Is there any specific hints you share or recommendations?
That's a good question. I try to tell my patients to find something that they may enjoy. So if it's even walking, cycling, to get outdoors generally is the better, even though we've had such a horrible winter.
Yeah, it sure has been.
Generally the better alternative to exercising. We find patients generally do like to get outdoors, but find something that you like. The other issue is find a friend, a partner, a spouse to try to embrace the exercise together so that it doesn't become a chore. You could even have a walking or jogging club, for example, that you can form in your neighborhood. You can do a book reading club and discuss the books when you're walking in your neighborhood.
That's a nice idea.
So there are a lot of ways to get creative with getting yourselves out. Join a bowling league, for example. But there are ways to do it. The most important thing is to find something that you may enjoy.
Right. And that's the point, too. I mean, just about everybody can walk. And that's what I tell a lot of my clients. It's like, okay, I know you might not like to cycle or run or whatever. Just about everybody can walk.
Right. And it's just as healthy for you, 30, 40 minutes a day at a good, slow to brisk pace. You can pick it up, and everyone can do it at any place.
Right, right. Now, in addition to diet and lifestyle, I know you have a line of nutritional supplements, some of which I have on my website.
Right.
Are there any certain supplements that you really think are kind of universally important for the average person that you almost always recommend to your patients?
Yeah, that's a good question. Vitamin D is critically important. And one of the issues with vitamin D is that, and this is a problem that we're seeing, if it's not taken with vitamin K, it can increase calcium levels in the blood, which can be dangerous. That can cause plaque, cause kidney stones, cause issues with heart arrhythmias. So we want to make sure that vitamin D is always taken with K. So that's one vitamin that almost all my patients get. When we do levels in the office, almost everyone is low. We also like things like quercetin. It's in our allergy formula. It's great for allergens. It's an antihistamine, natural.
Right.
But it's also important for cancer prevention, we see, and there's a lot of research behind that. We like vitamin C, of course, which is critical because we can't produce vitamin C. We're one of the few mammals that don't produce it. So we need to take it in. It's essential. And then a good multivitamin is critical. We also look at vitamins such as something related to homocysteine that lowers homocysteine, for example. So the B6, B12 vitamins.
Like from cardiofactor.
Cardiofactor, right, which is critical because you could have a perfect cholesterol profile but have high homocysteine, which is a protein in the blood, and that alone independently will cause plaque buildup in our coronary arteries or in our neck arteries. So we want to make sure that we're always monitoring and keeping homocysteine low, for example.
Right.
That's often quite critical. And we have some nice anti-inflammatory vitamins that we like. And turmeric is very important.
Yes.
Reduce inflammation. We like vitamins that also, like turmeric, will help with brain function. We have memory vitamins that are critical as we start to see, unfortunately, an increased dementia and Alzheimer's in society.
Right.
And that's growing rampant. So we have a whole line of vitamins that are essentially disease specific.
Right, right. And how about probiotics? What are your thoughts on those?
Absolutely critical.
As if I don't know.
Probiotics over the last 2 years or so have gotten so much important research. So not only from a standpoint of increasing the immune system, but we're seeing tremendous research and data that supports probiotics in preventing cardiovascular disease, for example, and for dementia, and increasing absorption of vitamins and nutrients.
Absolutely.
So probiotics have to be on everyone's list, probably of the top 2 or 3 vitamins that you need to take religiously on a daily basis.
Absolutely. Absolutely. Well, it has been a pleasure speaking with you today.
Likewise.
And I look forward to creating some more videos in the future.
Absolutely. My pleasure.
And to all my readers and watchers and clients, remember, holistic health counts.